What has been shown in literature and what we know from ourselves as adults is that what happens in our gastrointestinal tract has an effect on our brain. It's enough that you're hungry, it's a feeling from your brain, not from your gastrointestinal tract. And the same is when you've had eaten enough, it's your brain which tells you that you have reached the point of having enough to eat. So there is definitely a gut-brain interaction that we know as adults very well. What is very important is to realize that that gut-brain interaction is also there for very young infants, and that that gut-brain interaction is important for functional gastrointestinal disorders and for the development of your immune system. So a healthy gut microbiome will stimulate a healthy development of your immune system. But a healthy microbiome will also send the right signals to your brain of satiety, of happiness, of being generally satisfied and an acceptable good quality of life. And an unbalanced gastrointestinal microbiome is related to behavioral diseases. We know that children with autism, with attention deficit disorders, do have a different gastrointestinal microbiome than healthy children. That does not mean that by changing the microbiome we treat autism. That's a totally different issue. But it's obvious that there is plenty of literature that what happens in your gastrointestinal tract is in direct communication with what happens with your brain. What we can do to manage functional gastrointestinal disorders is to improve the microbiome in the gastrointestinal tract. So there are two ways how to manage functional gastrointestinal disorders. One is to do dietary interventions directly focusing on the symptom, which I mean, if you have a lot of regurgitation, it's obvious that the thickened feeding will decrease regurgitation. But at the same time, it's important to have interest for that microbiome, because that microbiome will send the signals to your brain, and that microbiome will tell you, it's okay, it's going better. So it's double management, directly focusing on the symptom, but focusing also on the gut-brain communication. And both are, I think, equally important. For the management of functional gastrointestinal disorders, I think there are some important messages. The keystone is that functional gastrointestinal disorders need explanation to the parents. They need reassurance. So they need the active intervention of a healthcare professional who brings reassurance, who explains what's happening, who explains that the prognosis is very good, who explains that it is decreasing the quality of life, but that it is not a disease and that it will go over. So bringing reassurance, which will improve the quality of life. However, if you only talk and you don't do something effectively, the mother will say, well, that doctor did do nothing. So I think the advantage of having nutritional treatment is that it enhances what you tell to the mother, because you can say to the mother, and we will now do something which will immediately decrease the symptoms of your baby. And it's very important that that intervention is effective, but at the same time, which is even more important, that it is very safe and devoid of side effects. And so doctors should certainly stay away from medication if it's not needed, because in functional gastrointestinal disorders, per definition, there is no disease. And if there is no disease, per definition, you don't need medication, because medication is there to treat disease. So reassurance and nutritional treatment in combination are the cornerstone of the effective management of functional gastrointestinal disorders.